All right, we got plenty of minutes to get us through. All right. Mr. Grandia,
Are we good to go?
we're good to go. Let's call this meeting to order.
All right. Keisha Johnner,
Here.
Mark Ramey,
Here,
Steve McCombs. Here.
would entertain a motion on this morning's agenda.
I move we approve today's agenda.
A second?
Jake?
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
Communications Board. Steve?
None.
Keisha? Okay, and none by me. Jake?
Nope.
All right, very good. We will move on. Public comments. This portion of our agenda, the public can speak on items not listed on the agenda this morning. The board cannot act on those items, but they could be topics for future meetings. So are there any public comments on items not listed on this morning's agenda? Renee? Nothing? And nothing in the room. We'll move on. We have this morning's consent agenda. I do believe we have an amendment.
We would just request that you pull claim number 56287. We would just like to get further documentation before it goes through.
Okay, very good.
Thank you.
So we have a request to amend the consent agenda with the claim so designated by Jake.
Yep.
Board motion to approve the consent agenda as amended.
So moved.
A second.
Ramey,
Aye.
Johnner,
Aye.
McCombs.
Aye.
All right, very good. Thank you.
Thank you.
On to business. First up, we have Sarah Bradshaw from Holmes Murphy to talk about our FY25 employee benefit renewal. Thank you, Sarah, for coming down in the weather. Do want to just highlight a couple of things. As most of you know from our postings, this kicks off budget week. It's kind of like, I don't know, finals week in college. It's something similar to that. So many of the topics that we'll be discussing this morning are also topics during our budget session. So the board may not make any decisions on these. These are presentations for information. And then we have discussion items during our budget sessions carved out for these proposals. So Sarah, with that, welcome.
Thank you for having me today. I'm Sarah Bradshaw with Holmes Murphy, the benefits consultant for Marion County. And we have a pretty short presentation today. We're going to discuss all of the benefit renewals that are coming up for July 1st and the ways in which we are going to fund those renewals. So if you wouldn't mind. Thank you. So,
And Sarah, is it okay if I just want to the board can ask questions as you go through it, or would you rather wait till the end of your presentation?
I'm completely fine with you asking questions
Okay,
throughout.
so don't hesitate to stop if you need something.
So first off, we will touch on the healthcare landscape in general. We'll talk about the 2024-25 plan recommendations that we have. We do have questions listed last, but of course, stop if you have any throughout. One of the things that we want to inform you on is just in general, what does the healthcare landscape look like? And it's unfortunately a little bit similar to what it was last year. We have factors that impact price and factors that impact utilization. So from a price standpoint, when we're just looking at overall inflation, think about a service that you had in 2023, a medical service. If you were to have that same service in 2024, you could expect that that service would cost about 7% more than it does in 2023. And then from a medication standpoint, that inflation is around 13%. We know pharmacy costs continue to be on the rise. There are different programs and competition within the pharmacy industry that are coming to the surface that are meant to help bring those costs down. It's going to be a slow process to get there, but there is a lot of talk around pharmacy legislatively on Capitol Hill. So this will continue to be a topic that we are working towards controlling. One of the things that Wellmark is doing in your fully insured renewal for this coming year is they're adding a program called Prudent RX, in which individuals who are taking a medication that is a high cost medication will be outreached by Prudent RX, and they will be able to receive their medication at no cost. with the caveat that those on the high deductible health plan have to meet their minimum deductible first. This plan will allow savings from the manufacturers to be able to be realized through the health plan, whereas in years past, that was not the case. So Wellmark, as an insurance carrier, is taking steps to try to control those rising pharmacy costs as well.
Sarah, can I ask a quick question?
Yes.
Just so I make sure I understand. So in the past, if they were an expensive, prescription, it would, I mean, how would that work then versus now? Then you have to meet your deductible first. Because I know some of those scripts can be very expensive.
Really good question. So if you're on a high deductible health plan, your process really won't change from what it was in the past. So you do have to pay towards your full deductible first before you get anything covered at 100%. So going forward on the Prudent RX, you would still sign up for the program being on that high deductible health plan, but then you would meet your deductible first for that medication. And then after that, the drug will be covered for you at 100%. The way that it works going forward is that now the health plan itself will realize the rest of the savings on that medication throughout the year, even though you've met your deductible and you're not paying anything for it.
So it wouldn't affect the HMO and the PPO plan because. it's already-
Correct.
Okay. Right.
Correct. So individuals on the HMO and PPO who are taking a Prudent RX medication will essentially have their cost share waived on that drug.
Very good. Good question. Good, Sarah.
We also have a lot of advanced technologies that are coming to the market, which are very important as we look at overall health and, treating some of those rare conditions. But that really does lead then to a prevalence of those $1 million plus claims that are happening. And there are insurance carriers behind the scenes within your health plan that cover those catastrophic losses. And so the cost of that insurance is built into your health plan as well. So as we think about just in general, the costs are rising because we're having prevalence of higher cost claims in the market. Then when we look at utilization, there are three main factors that impact that. One is age. Unfortunately, as we age, we tend to use a little bit more healthcare than we did when we were younger. Health conditions as well. So some people are born with health conditions, some are lifestyle related. And then lastly, this last bullet point really came about during the pandemic where individuals did not go to the doctor and get their normal preventive care. That is now catching up with people. And so what we're finding is in some cases, individuals have later stage cancers that are diagnosed late, whereas before they may have been caught early. Any questions on the landscape?
That increased prevalence in $1 million plus claims, that's an overall.
Correct. That is not specific to Marion
Right.
County. Great question. Next, we are focusing here on the year-over-year medical plan performance. If you just look to the very far right, that has the red rectangle around it, that represents the loss ratio from each of the prior years. And the loss ratio is claims paid versus the premiums paid in. So if we go to the 2019 timeframe that we're looking at, for every dollar that was paid in premiums to Wellmark, they turned around and paid $1.15 out in claims. Okay, so they were not making profit at all to be able to, administer your plan and basically keep the lights on. Similar story in 2020, where we had 102.3, and then we looked better in 2021 from a loss ratio standpoint. But then again, we are ticking back up for this most recent year.
And they typically take the 4 years, and is that something that they keep in consideration when they do your increase? Is that correct, or how's that work?
Great question. So typically what they would do is look at the most recent 2 years to then rate your renewal. So a portion of the renewal increase would be weighted towards the prior year's claims experience and a portion would be weighted toward the current. What Wellmark did this year is they gave you a 3-year average because of the way that the claims were running. And that actually worked in your favor,
So waiting would have made it higher.
right?
Yeah.
When we're looking strictly at the medical and pharmacy claims paid at the bottom of this page, our medical claims paid for the Marion County membership is trending at about 42% higher than where we were last year. Pharmacy is trending in the right direction. It is about 4% less than what we had paid last year. However, I wanted to make note of the 37% of total claims. What that means is out of all the claims paid, 37% of those were driven by the pharmacy claims. In the industry in general, in the market, we are seeing that percentage to be closer to 25 to 30%. So we know that the utilization is a little bit higher than the average industry. But again, Wellmark is taking that step to put in prudent RX to hopefully combat some of that. Any questions? Thank you. Here we have our overall recommendation. So first and foremost, we do recommend that we renew all the current benefits and insurance carriers with no changes to the plan designs. There will be a slight change in plan design on the HMO, and that is not noted here, but there will be a $5 copay incentive to see a designated primary care physician rather than just a network physician. That will be communicated to employees during open enrollment. So that is a positive impact to the health plan. Our second recommendation here is that Marion County absorbs 73.5% of the $183,415 health insurance increase. The overall increase from Wellmark was 9.25%. So Marion County's portion of that comes out to $134,778. That is based on the current enrollment splits, so that could fluctuate after open enrollment if individuals make different plan selections.
So Sarah, I'm going to jump in here since you and I have talked. So as we did in past years, I had Lisa review what we have accrued in our dental plan, and we have an account there that we fund because it's self-funded. Well, we've accrued a significant amount of money again in that dental plan. That being mostly employee money, we felt that it was totally reasonable and fair to try to keep the health plan rates for the employees the same and apply some of that difference. We have plenty of money to cover our dental claims based on our claim trend history, and Sarah will talk about that. We average about $20,000 of claims a year on the dental side, and we're accruing far above that level right now. So what this allows us to do then is keep, so your health insurance rates for the employee don't go up. So they stay flat for this year. I think what that does though is we'll probably do some research over the next year as to why we're over accruing on the dental plan. And we need to institute that project right after the budget sessions and see why that's happening. But that being said, we do have that ability to do that. And then the Marion County piece is just the rest of that rate increase component. So that's what's built into this to try to hold down costs for the employees. Sarah, did I summarize that fairly?
You did well.
Oh, thank you.
Yes.
Thank you.
Anyone have any questions around the strategy of utilizing the dental funds to hold employee health premiums?
Now that is just a the dollars that have been accrued. It doesn't affect the plan itself.
Correct. That is
Yeah.
correct, Steve.
Okay.
And there's plenty of dollars remaining. I believe, Lisa, when we looked at it, we were over 100 and I don't remember the exact number.
Well,
Right.
that's the question that's gonna be asked.
And our-
Is
and
it
our
gonna-
plan-
Is it gonna affect the
Yeah.
dental plan?
So if we take 48,000 and fund the employee portion, we're, like I said, we're averaging $20,000 of claims a year on the dental plan.
Okay.
So we are over accrued. And we need to find out why that is, and we will work on that, but that does give us the opportunity to hold health insurance rates down. And it's employee money, so it should go to the employees.
The latter part,
That's that's the theory. We'll work on, we'll decide whether we want to do it or not in the subsequent meeting. Sorry.
you're fine. So the latter part of this page, we just want to point out, Marion County will continue to pay the average of 42% of the dental premiums totaling around 32,405. That is Marion County's portion. Of course, the employees contribute an amount into that fund as well. And as Mark mentioned, we will do an evaluation over the course of the next several months to determine appropriate funding levels going forward. Because this plan is self-funded, there are recommended funding rates that come to us through Delta Dental, but it is heavily impacted by the actual utilization within the plan. Of course, we want individuals going to the dentist and getting their preventive care, and of course, any of the other services that they need. So we'll make an attempt to get that evaluation done. Also, Marion County will continue to cover 48% of the vision premiums, totaling 7,741. There is no increase in the rates for vision for the upcoming plan year. Basic life premiums and accidental death and dismemberment, those are also covered by Marion County, totaling just under $14,000. And again, no increase in those actual rates going forward. There are also flexible spending account and health savings account fees that are covered by Marion County for those individuals electing those accounts. And additionally, Marion County will continue to contribute into the health savings account at the amount of $1,500 per year for individuals who are enrolling in that high deductible health plan.
Sarah, on those scripts that you talked about, that were with the high deductible plan, is that something then that will be a list when we go through, renewals? Is that something that will be provided? Because I'm sure there'll be questions. Do I have one of those scripts? Or, so wanted to know how that information would be given to the employees.
Yes. So right now, if you were to just go out to wellmark.com and scroll down to the bottom of the page, there is a Prudent RX drug list out there. It is ever changing. So at open enrollment, we will provide a list or at least a link to the list because it will be most current if we provide a link. Also, individuals who are taking a medication on that list will be outreached to about 1 to 2 months prior to July 1st. So they will receive a letter in the mail. And, if there is any confusion around that, there's a phone number to call to get set up with Prudent RX. But everybody that is directly impacted will receive a letter.
Thank you for that clarity.
Okay, so just to recap on the health plan recommendation, again, the Wellmark renewal came in at 9.25%. That equated to $183,415 in an increase over what we're paying today to Wellmark. Our recommendation is to renew with those current plan designs. So there are 3 medical plans that are offered. Those will remain largely unchanged with the exception of that primary care copay incentive. Marion County will absorb $134,778, which is approximately 7.9% increase to Marion County's cost. The dental fund will then make up the difference of that health premium increase, and the HSA contribution from the county will remain at $1,500 annually. Our recommended contribution strategy for the medical plan, it's fairly straightforward this year because we are recommending to hold the employee cost at what they are today. So the top portion of this screen, you can see on the left side, that is the enrollment count by plan. So you can see the different enrollment splits that are there. And the numbers there represent the actual employee enrolled. So we're not counting every dependent on the plan with these numbers. It's simply every employee. That employee cost is listed in that second column there, and those are monthly costs. Followed by employer, and then the actual employer and employee percent cost share of that total premium. When you get down to the bottom of the page, this is where we are indicating the monthly impact. At the very bottom, then we have the annual. I think it is cut off on your screen, but that annual increase nets out to that $134,778 that Marion County is going to absorb.
And just to jump in here for a minute, Sarah. So understand two things just from an employee's standpoint. As we go through the project to determine the rating on dental and the over accrual, our ability then to mitigate rate increases in the future may be impacted by that. We may have to find other ways to do that, particularly if rates continue to climb as they've been climbing. Now, there are two things that I talked to Sarah about we'll be working on this year. Number one is the dental accrual and why we're over accruing. But number two is, should we be looking at some other plan designs? And I've talked to Sarah about that, and she'll start working on maybe we have a portion that's self-funded. There's a give and take on when rates start to increase too much. We may be able to, as a county, then reserve some cash to self-fund a portion of those rate increases. So we'll start working on that. Again, the goal is to provide employees with a high quality, competitive benefit plan. And I feel we've done that over the years. And we've done everything we can to try to keep affordability and coverage in mind. So just so you understand that piece. The second or third thing is the high deductible, the HSA account. I had toyed with the idea of increasing that contribution this year. I think financially it doesn't work. Again, the board, we can certainly talk about that during the health insurance discussion for budget, but it's still very competitive. I think when we've looked at other HSAs, and Sarah has done this work from a public standpoint, that rate is still very, very competitive when we look across the marketplace. So right now, I don't see a need to increase that component yet. But again, when we get to our health insurance discussion, we can certainly have that discussion at that time. So just wanted to provide a little bit of color to kind of why we're in this position right now. Rates are increasing. The book overall for Wellmark is taking some large losses. When you look at our claims history, it's a severity issue, not a frequency issue. So that poses some different financial challenges so that we can hold rates down and still provide the type of insurance that we think our employees need. So just to provide a little bit of background. Sarah, if I misstated anything, just don't say, Mark,
No.
you were wrong.
No, thank you for that input too. And we will be evaluating alternative ways to mitigate those renewal increases going forward. So a large portion of the membership within the health plan utilizes less than $1,000 in claims per year. So when you look at your plan design, it is more than adequate for a large number of members. How could we then look at buying a higher deductible and then funding that deductible down from the county standpoint so that it looks and feels the same to you, the member or the employee, but we're paying less in premium to purchase a higher deductible plan.
Yep.
From a dental plan standpoint, as I mentioned, Delta Dental provides suggested rates to the county as a self-funded employer. That is, based on what they see within their book, what they expect your utilization to be for claims going forward. They also have administrative costs, and that is reflected in that small increase that you see here on the screen. So they typically increase their admin fees. So think of it as their fees to rent their network, pay your claims, administer the plan in general. That is a small increase, equating to about $219 for the year. The fund is going to absorb that increase, and the employee contributions will remain unchanged. And similar to the medical strategy, we have the dental here. You can see again on the left-hand side, we have the enrollment count, and that is 79 singles, 46 families. The employee cost is listed in that second column, and again, these are monthly rates, followed by employer cost, and then that total suggested funding rate, or that total funding rate that we have in place today. So at the bottom of that page, you can see, again, we are not increasing the employee or Marion County's contribution. We're just assuming that the fund is going to absorb that minimal increase there. That brings us to the end. Are there any additional questions?
Keisha?
No, thank you very
Thank you,
much.
Sarah.
Thank you very much.
Sarah, thank you very much. Thanks for making the trip down.
You're
Sure
welcome.
appreciate it.
Stay safe, everyone.
Yes, and just as a footnote, I think health insurance is when on our budget discussion. Do you know off the top of your head, Renee? No, I'm putting her on the spot. I shouldn't do
I
that.
don't have that.
Thank you.
It's all right. It's all right. Thursday. So for the board, please, and Sarah, you're open to them calling and asking questions, and yep, so gather information. We've got all the, it's fairly, I don't want to say vanilla this year, but we're not doing a lot of things with the health plan other than trying to hold rates. And now as we go forward with claims histories and things like that, we're trying to say, do we need to think about some different designs? One thing I do want to highlight that we haven't done in past years, and Sarah and I have talked about this, is from a privacy standpoint. Want to make sure the employees know that we don't see any of your personal data when we do these, when we do this analysis. Everything is aggregated. There's no personal information. It's just aggregated data about our plan. So your data is held secure, and we take privacy extremely seriously. And Sarah at Holmes Murphy, their compliance department keeps us in line with all of that. So we thank them for their help. If there are no questions, we can close discussion if there's a motion.
Motion, we close discussion.
Second,
Johnner,
Aye.
McCombs,
aye.
Raymond.
Aye. Thank you. Next, we have Impact, the annual update and their FY25 support request. Renee, are they online?
Terry is.
Yeah.
Brandon is too. Good morning.
Good morning. Can you hear us?
Hi, Brandon. Hi, Terry.
Hi.
So thank you.
Um,
Zoom. So if you could, obviously we have your letter in front of us. If you.
You can't hear us?
No, we can hear you. Can you hear
Oh.
us?
excellent. Yes. we can hear
Yes,
you.
sorry. Yes. Pardon me.
I just, if you guys, we have the letter in front of us,
Mhm.
Vasquez, but if you could please just, give us our overview. We will-
Absolutely. Yes. So we're disappointed to not be with you in person. We were, a little concerned with the uncertainty about how much the freezing rain would be. It looks like it probably would have ended up being okay, but hard to make that call ahead of time. Yeah, so as you can see in the letter that we sent you, that past year we served about 1,700, well, about exactly 1,700 Marion County residents with our services. So that would include rental assistance, energy assistance, water assistance, and some of those other smaller localized programs we have. That's 773 families, about 642 of the residents we served were children, and over 8,000 services provided to Marion County residents. So we're pretty pleased with the work that we're doing in Marion County, but we know there are more folks in Marion County that could benefit from these services. And that's why we have a couple things we'd ask you all to support. So some of this are things you're already doing, referring community members to us that you are become aware could benefit from our services, letting us know about community needs you're hearing from residents, helping us build connections with other community groups and organizations and businesses in the community. A great example of that is we received funding through United Way of Marion County this year to support our homelessness prevention program, and Supervisor Yanner was able to help us secure that funding, to help us build those connections. So continuing to get support from you all on that sort of effort is much appreciated. And this year we are also requesting you to support us with the homelessness prevention program with an investment of $12,000 this year to support families. We do consistently find that housing assistance is one area that is of great need in Marion County, well, across all 5 of the counties we serve, but Marion County for sure. Our team receives on average about 10 calls a week from Marion County residents that need housing assistance. We don't have the funds to help all of them, unfortunately. So we do refer to other organizations in the county that do work to assist. But we know that the need is there. So that's kind of the quick overview there. There's obviously a lot more detail in those documents. I'm happy to go over any of that or answer any questions you have.
Yeah, I have a question. So when you say 8,000, 8,125 total number of services provided to Marion County households, can you further expand on that for us? What you mean by that?
Absolutely. So that would be, so for example, if we help a household with housing, then that would be one service count. But if we help that same household with energy assistance, then that would count as a second service for that household. So it's counting each service. So each household may receive more than one form of assistance from us. And when we do meet with a household, then they may come to us for one thing, but our staff will talk to them about what other needs they may have. So if we have other things that can help them, we can provide those services. And if we don't, we can refer them to other organizations in the county that may be able to help with other needs they have. So for example, if a family comes to us and they also could use help with food, and we don't have a food pantry in Marion County, but we can refer to the other organizations that do and say, oh, you could go to these locations and they could help you. So we try and build those connections for folks so that they can get all of the assistance they need.
So if they were to ask those questions, then you count that as a service?
No, if we're
No.
if we're referring, we're not counting that as a service. The service is just when we are providing the service.
Kim, do you coordinate with Impact at all on the service aspects of their enterprise?
I just texted Dell before the meeting to find out how things are going. And she says that when she makes referrals to Impact, we've not had any success in getting people linked up with the rental assistance and those kinds of things that we need. Everyone I refer tells me they have no money for Marion County, is what she said.
Okay.
So I don't know that they have not participated at our monthly provider meeting in a while. I had her look and see from attendance whether they've been here, and she, you know, it was a quick look, so she may have missed, but she didn't see any participation in the last year.
Is that the meeting that our colleague Stephanie would be? We have a colleague who attends meetings, provider meetings, and she's been out on, she's just recently returned on maternity leave, so I'm not sure if that would be reflective of the meeting that you're referring to.
Yeah, I don't know.
And if not, then we certainly want to know, because we want to be a part of those meetings.
Yeah, I don't know that. I would have to
Mhm.
tell.
Mhm.
But when we don't have, we require the people who come to us for general assistance or rental assistance to go to all the other places first. And
Mhm.
we've not had any participation from Impact for a bit.
Yeah, our rental assistance funding in Marion County has been very limited over the last couple of years. So we've been doing,
And that's what we're trying to build up.
yeah. So we know where
Yeah.
we've got the assistance, the funding through United Way of Marion County for that. We also have some funding through the Iowa Finance Authority that will go to support Marion County with a different rental assistance program. So we should have more funding here going forward, but that is what we're working towards.
Can you
So-
tell us more about how you work with the homeless population here in Marion County?
Our work would be more of, are you talking to Impact, asking that question to Impact?
Yes.
Yeah.
Yes.
Sorry, Brendan, I'm going to jump in and then you feel free to
Absolutely.
jump in too. Our work is more about preventing homelessness. Our services, we're not in the actual service sector of serving the homeless. But we work with families who are at risk of homelessness. And that's what this funding is that we're asking you for. And I think we're all kind of saying the same thing, is that there's a huge need for this, and based on this conversation, but also the numbers are in the actual application packet that we submitted. And what we're trying to do is build up support, a coalition of support from this request today that we ask of the county, adding to the United Way request, and we're also seeking private support. We're just trying to build that up, knowing that there's tremendous need.
Do you participate in our local homeless coalition meetings that are held here in Marion County?
I would have to check on that. But we would certainly be open to that if that would be useful.
I don't
Yeah, we
think,
definitely want to participate in those sorts of
Mhm.
coalitions. But yeah, I'd have to check with the members of our team that take a more active role
Do the
in
direct service. We value partnerships, and across the counties, we have almost 500 partnerships. And we're always seeking to build those partnerships. And this sounds like a really valuable one. If our colleagues are not already participating and we just don't know about it, we certainly want to look at it.
Yeah, I would certainly encourage any request for county funding for social services. There should be some level of coordination with our public health department.
Mhm. That makes sense.
That should be just part of the deal. We've done some interesting things within public health to have care coordination,
Mhm.
nutrition, and those types of things. And I would think this would fit right into that same bucket. So, like anything that we would contribute for the residents of Marion County, we would certainly want to also have you be in
Mhm.
a working relationship with our public health folks. I think that should be a requirement of anything that
absolutely.
to impact.
Also, is there a correlation or connection with funding or partnerships with the cross mental health region or Heart of Iowa now or different ones?
It's a good question, Sheriff. And do you guys work with the mental health regions at all, the cross region, which is the region that covers Marion County?
I would, off the top of my head, I would say mental health is definitely connected to the work we do, but it's not a direct, it's not in our mission to address mental health. So my guess is we're probably not so connected with that sector, but again, we appreciate your guidance on how we can best serve the residents of Marion County, and I'm absolutely open to looking to participating if that would be useful.
Well, yeah, I think it would. And
Mhm.
I'll let Jason speak for himself since he raised it. Make an excellent point.
Mhm.
But even though it's not in your mission as a social service provider, there certainly is an intersection somewhere.
Mhm. Absolutely,
Do and what our mental health folks do. So
right.
at a minimum, awareness of what you have going on and what's going on in that sphere can help provide
Mhm.
services across the board. Jason, I think, is that fair?
Yeah, most definitely. I think there has to be that connection. And just even on the expenses, I mean, that go along and are associated with that. I mean, there's definitely that tie-in together. Just looking at the PowerPoint here, what is the total request from Impact?
We're asking for, go ahead, Brandon.
They requesting $12,000.
12,000, Jason.
Okay.
Yeah. Okay.
Nope.
Anything else?
Questions, you? No.
Keisha, what,
On
you're probably the closest to
Yeah.
this. What are your thoughts?
So we, obviously I am, the board, representative from Board of Supervisors on Impact. And we meet monthly. And we've had continued discussions. I will give it credit, Brandon and Terry have both been trying to be much more involved in Marion County. So I do think that there needs to be maybe some more growth there. Terry, if there's any way that, you know, whether it's working with our public health, relationships need to expand. I know in the past, when you were located at 6th Street, we give you like an in-kind because of you being at our building, but you are now located, where are you guys located at? Could you tell?
Yeah. So yes, yeah, the county used to provide in-kind office space, and of course that wasn't being utilized during the COVID lockdown. And so then after that, we moved into sharing space with the Knoxville Public Library. We have found that the folks that we're serving in Marion County really prefer to access our services for the most part over the phone. So we have shifted that service delivery again to now for in-person in Marion County. Anyone in the county can request a home visit. And so we can serve them that way if they'd like to receive their services in person. Otherwise, all of our services are also available over the phone. Several of them are available online as well. So that is, we've shifted our delivery, service delivery again, as we try to figure out what's the best way to serve the residents of each of the counties that we're in.
Yeah, and also to speak to the board, and we have talked about this at Impact too. Some of us are smaller counties. We are looped in with Polk, and so it makes it difficult because Polk does receive a large portion of the funds when it comes to Impact, because obviously they're larger. But, you know, I appreciate you coming. I appreciate you presenting. I think as board, I think we should just think about it. And then I think this is a topic of discussion, I think in a later meeting this afternoon or, yeah.
Okay.
Have we met the requirement for this contract to contribute to nonprofits as a local government? Have we met that? Well, it says here, you know, we're supposed to have a contract in order for.
Yes, that would be, they're just saying you do have to have a contract
Yeah.
now. Yeah.
Yeah, that's just a template if you should choose to use
and
that.
was just, since a couple of years ago, the state auditor sent out that guidance. We started including that template in all of our funding requests to cities or counties, just as a sample. If you had your own thing you wanted us to use instead, we'd be happy to do that.
Okay, well, thank you.
Thank you. If I could just conclude, I want to also thank all of you for your insights and especially Supervisor Johnner. And I want to say, I think that we're all sharing in the same concern, and that is how can we best assist Marion County residents with, for impact, we focus on essential needs. And so that's why we ask for housing, because housing is probably one of the most basic needs if you look at Maslow's hierarchy. And with that, I just really appreciate your insights on connecting with public health entities and the provider group. We really truly want to connect as best we can with groups and individuals in Marion County, and also other groups who can support this. So we're not asking for the county to support this whole project. We're trying to build a coalition of support, and we appreciate your insights in that way as well.
Well, very good. Thank you for your time, folks. We sure appreciate it. And Keisha, make a motion to close discussion.
Motion to close discussion. Thank you, Terry. Thank you, Brandon.
Thank you. Bye-bye.
Thank you.
Is there a second?
Yeah.
Oh,
McCombs,
Aye.
Ramey,
aye.
Johnner.
Very good. Thank you. Next, we have Marion County Librarians Annual Update and their support request. Who is speaking for the librarians? Okay.
Melcher Dallas librarian is online.
Okay.
And I think the Bussy librarian had a hard time connecting on Zoom. But I guess since, well, I do have some handouts if that's okay.
Sure. Absolutely. Absolutely. Thank you. Thank you.
We have the annual
Thank you.
report for last fiscal year for Knoxville. And what I will talk to it.
All right. Thank
just
you.
this, just that infographic to, just the highlights. And the difference is that for the infographics, I just highlighted 5 points about the Knoxville Library, and it's for the annual year 2023. And the annual report is more of the fiscal year 23. Just 5 things to highlight. There are 8,825 card holders that have the Knoxville Public Library card, and 64% of them come from the city, and 31% of them come from rural Marion County. Last year, we had 19,957 library visits, 228 programs, and 6,560 people who attended those programs. There were 37,691 books that were checked out, and 60% of the circulation that we get is from the city and 32% from rural Marion County. But one of the things that every time we report to the Board of Supervisors about circulations, we usually do physical items, but we don't really count electronic items. And that is a number that is increasing and have consistently been increasing. And there were like 12,809 items, ebooks and audiobooks that were checked out. And that service is available to all of the card holders, everyone who holds a card from the library. And then all of the different items that we check out to our residents, like the movies, the computer checkouts, the audiobooks. And then more recently, a lot of the libraries offer streaming movies and music, magazines, and so on. And we offer free Wi-Fi access to everyone. Even during the pandemic, we had hotspots that we checked out to people so they could bring a hotspot home, so they would not lose connection to access to the internet. And then we also offer the Adventure Pass program, which gives people free access to the Science Center, the zoo, and the Botanical Gardens. And those are just my highlights. for
Can
the-
you highlight to me, what does it mean when you say free access to the, botanical and the zoo? I mean, do you have to pay? Do they have to pay something or is
Uh,
that?
No, what it is we buy the membership to those places, and people can go to our website and then they can choose a date that they can visit any of those places, and they get 2 free adult tickets and 2 free children tickets to go to any of those venues.
And so that's one time per family?
Yes. Mhm.
Okay.
Yep. Do you have any questions?
No, it's okay.
But I
Thank you.
think-
Is
I
it,
think
is somebody
that
else?
was- Mhm.
Okay. All right. Very good. Whoever's next.
Morning, Mara Strickler with the Pella Public Library.
Good morning.
So a few highlights of our services from the past year. We have just over 2,000 cardholders who are residents of rural Marion County, and that is approximately 21% of our cardholders. Those cardholders borrowed 34,601 hard copy materials. So they're very avid readers and users of the library. We filled approximately 200 requests that we received from residents of rural Marion County for specific titles. I will say that's a bit of an undercount because we did switch requesting systems mid-year, but that gives you an approximation. And Rosalind mentioned the increasing use of electronic resources. Residents of rural Marion County borrowed over 3,000 titles on the platform called Hoopla in the last fiscal year, and that would be resources like ebooks, e-audiobooks, magazines, and streaming video, as well as music. And they borrowed just over 6,300 titles on Bridges, which again would be e-audiobooks and ebooks and magazines. And we do continue to see increased usage in our online resources. We saw an increase of approximately 10% in Bridges usage and 25% on Hoopla. And the online resources are quite costly for individual libraries to be able to provide, either for the annual subscription for Bridges or on Hoopla, which is a pay-per-use model. So every time a patron borrows an item, that's a cost for the library. That
When you talk about Bridges, is that, I know, do you guys have something with Central College you use? That's not this, correct?
No, so we used to share a catalog with Central College, but it has been several years that agreement has been separated, and we've had our own catalog separate from Central College.
Okay. All right. So this is an app like Hoopla is then?
That's right. Yeah, the name of the app is called Libby, so it gets a little bit confusing because they have different names
Right.
depending on what platform you're on.
Yeah.
Bridges is a consortium of libraries that buy ebooks and it's available.
Are there any questions for me regarding the services that Pella Public Library is providing to residents of rural Marion?
Do you mind? I didn't ask this, and maybe it's in your documentation here. What's the total budget for the Knoxville Library?
The total budget?
Yes.
It's 443,000. I think it's in the report there.
Is it in this, is it in that
Yeah,
annual report? you
And,
just
and
gave
the
us?
county, yeah.
463.
463.
Yeah.
Okay. And what about,
And
466.
the county portion is about 2% of that.
Yeah, thank you. And what about Pella?
For Pella, the annual budget has been approximately 780,000, and the percentage from Marion County for the past year was approximately 6%.
Very good. Thank you very much.
You're welcome. I also have a bit of information from the Bussy Community Library Director. She was having child issues and connectivity issues, so she forwarded some information for me to share with you today, if you don't mind.
Absolutely.
So she addressed several different questions in her report. Firstly, how do modern libraries serve our community? Free access to internet, preservation of history, promoting literacy, providing reading materials and access to information, public print services, free events for all ages, and what she describes as sanctuary. And how has the Bussy Community Library served our community? This is a small list of ways we have provided for our community this year. Many kids coming to the library after school to work on projects and activities. College students have used our free internet access to attend their online courses. A retired professor has used our print services to send customized cards to museums with artifacts from Vietnam. Family used internet access to file immigration paperwork. Child used access to our computers to create flyers for dog walking business. And a patron who lives off-grid uses our library to handle business calls and connect with family. Events at the Bussy Community Library have included toddler time, rock painting, geocache workshop, navigating Medicare, sidewalk painting, movie nights, Pokemon battles, resume builder workshop, Periscope STEM activity, paper boat origami, brick book painting, book clubs for youth and adults, Halloween handprints, Santa reading, and reading at local school district. And some of the updates to the facilities have included new gutters, automation of library materials, updating the media center, and a shed built by Twin Cedars shop class. And the services provided have included print services, free internet access, free reading tutor, free access to reading material, interlibrary loans, and access to historical documents. And she concludes stating, we appreciate the support of Marion County. Your funding helps our library focus on our future to serve our patrons and community. And I have some basic circulation information as well, if that would be of interest.
Excellent. Thank you.
You're welcome.
Are there more people talking? Okay. Yes, absolutely. Absolutely.
I'm Joanne, like from the Webshadle Library in Pleasantville. And so may I pass out? The
Sure,
annual budget
sure.
too?
Absolutely.
And this, the annual budget.
I make no promise that I'm going to read all this as you're talking. And yep, perfect. Excellent.
Because I know that.
And Joanne, when you go back, will you pull the mic up so they can, everybody on?
Thank
can
you
hear
very much.
Thank you.
Thank you.
I'm just grateful to be here and to thank you guys for supporting us libraries, because we're all on the mission of just trying to get people into our libraries to get them reading, get them access to stuff that they're in need of, and we're just glad our doors are open. So on the front page, I did do the amounts of our rural circulation and how many people are in our just statistics and stuff like the other libraries. But what I'm most proud of is all the different events that we've been able to hold at our library. And what have we been doing with the funds? We purchased new books. Our books are I started in 2016, and ever since then we've been trying to get new books in, but it's something that books have increased, and it is very time consuming, and it's going to take a while to get it all up to where it's fresh and new. We got some new fire safety panic doors, and it was the point where we have double doors. One of the doors kind of went off the hinge. We had the city come in to work on it and they said it was fixed, but they said don't use it. So it was kind of one to the point where we had to do something because, yeah. Oh. And so, we got new large screen computer monitors so that visually impaired people can, look at the computers better. We got a door monitor because we've been, to keep records and stuff, it's really hard, like when a person comes in and we have different events and we're on our little sticky note. So we got a door monitor, so when they come in, it's not hi-fi fancy, but it has its problems and glitches, but at what we can afford and what we can work with, we love it. So, what we're hoping to do with, if we get any funding, is just to keep our doors open, to be able to do what we've been working on doing, is just to, purchase new books, replace some of our old and damaged furniture for our young adult area. We purchased the Adventure Pass. We also are able to, the Adventure Pass is awesome because with the library card, any individual 18 and over can check out 4 tickets, as she said, to the Science Center of Iowa, Blank Park Zoo, and Britton Skating Plaza, which is something because in small towns, not everybody can go on vacation and stuff. And so this is great that we can give that opportunity to.
Joanne, can
individuals.
you tell us, what does it cost for this Adventure Pass?
It's like $250. It just depends. And that's per venue. So you have to pay so much to each venue, but then the people can use it, the adult can use it once a year to each venue. But then if there's a couple that has, married couple or just a couple that's came in, they're both 18 and they can both use it once on each of their card. So they're able to take their family twice. So, it's something that I actually went over to the school and kind of went to each of the classrooms and kind of advertised it because a lot of the people don't know that it's available, because when they think of libraries, they instantly think of books, but that's also something that's now available, which thank you to the money that we received because that would help us fund that. But we also do, I know you're probably like, oh, okay.
That's okay.
Every time we have our community garden. One of the things that we've started doing is the Pleasantville Band and Choir has been coming and doing concerts on the lawn, which is kind of fun. That gets a whole new group of people into the library. We do miniature golf, reptile events. We do fundraisers, Money Smart seminars, author events. So much. We try to do as much as we can on our little budget, and we're just grateful for having our doors open. Is there any questions? Because I'm kind of nervous and I'm not really sure what to tell you.
It's okay. You're doing just fine. Board, do you have any questions like that?
No, she's pretty.
Okay.
No,
Anything else you'd like to add?
I'd like to thank my volunteers because we're a small library and it's just me and another lady that comes in like 8 hours a week. And so if it wasn't for my volunteers and our board, I wouldn't be here. So thank you.
How- Can I ask you, you talk about keeping your doors open.
Yeah.
Okay, and I think I've asked you that the 3 years you've been here. What do you need? What does your budget have to be to keep your doors open? Because when people say that, then I kind of want to know what the number is.
It depends on if we're wanting just to keep the doors open or if we want to be able to purchase books and programs on top of
Just to
that.
keep them open. So you can't do anything.
Do you have accreditation though, Joellen? Don't you have something where you have to, something about you guys have to have so many books?
Yes.
Is it, I don't know what it is.
Well,
but-
whatever that is, what's
Yeah.
that number?
So by state, they're wanting us to have 3% new books in yearly and to weed 3% books out of the library
So
yearly.
what does that accreditation do?
It gave us what, 1,200? We were able to receive $1,200 from them for us to be able to accomplish the accreditation, but it's mostly just as checks and balances of what our library provides and like handicap accessibility. We had to go and do a checklist to go through the whole building to see if that is. CE credits is the director taking so many online classes through the state to kind of keep up to date on what is going through the state. And then just, it's a, it's a, it's a happy thing, but
So
it's-
there's library accreditation.
yeah. And we're kind of proud because this was the first time we ever had to apply for it. And
Is there anything the state doesn't get involved in? I'm sorry.
Yeah.
actually,
Does the state give you money?
Accredited library. Or, library loan, or, open access to that's like your- So they do provide that to accredited libraries that we fund.
Okay, I learn something every time you guys come in. Thank you.
so you did ask me the question
Yes.
on how much it would
Yes.
cost. Would you say 60? Probably 60,000, just to keep our doors
Okay,
open
just to
and.
keep your
Just
doors
then
open.
But
Okay.
that wouldn't include any type of story time programs, books, anything else. That's mostly just to keep the electric lights and salaries.
Okay, perfect.
So,
Thank you
but-
very
but
much.
thank you.
You did great. Great.
Good morning.
Good morning. How are you?
I am good. This is Lori Davis over at Melcher Dallas.
Right.
And I'm
Lori-
sorry I'm not there, but I hate this weather and I don't drive in it. After listening to all the other wonderful ladies that work in Marion County, we can all sing our praises. We all do the same things. My rule circulation for the last year looks like it was nothing compared to the big libraries, but I had 1,335 checkouts last year in our small town. My budget is $38,000 a year. You can do a lot with a little, and it's not all about the checkouts. I have Libby or Overdrive. I have the Adventure Pass. I don't know how the money that we're asking for can be divided equitably. Nobody else has mentioned money. I would really like to see at least $6,200, which is what has been the average that we've received for the last 5 years, other than the big bonus year. This is really hard to do when I don't have a camera and I'm not there. Do you have any questions for me?
No, that's all right. Board, do you have any questions?
No, I appreciate it, Lori. I appreciate you giving us the input. So, and
Yeah.
you do have the adventure pass, you say, within your
I
budget?
do.
Yeah.
Yes. My friends group pays for it.
Oh, okay. So the friends group of the library.
Yes. The same 5 people that raised enough money to redo this whole building
All right. Very good.
without tax dollars.
Hey, Steve, any questions?
No, I haven't.
Keisha?
Thank you.
Any
Have
other?
a good day, guys. Thanks for listening.
Thank you very much. Thank you. Any other questions or any other presenters? Okay, we need a,
we've been working on how to fund our library. As you guys know, we were a private library for many, many years, kind of fell into disrepair. There's been a few of us that have worked really hard to make it a public library, and it changes how we get funding. We're all really learning how that works. The city had to come up with money that they've never had to come up with before to fund our library. So we're really trying very hard to figure that out. One of the, I've been digging into some of the statistics. I do have a printout if you guys would like that kind of compares where all the different libraries fall in comparison to their class for how they're rated for their circulation and their funding by the county or their funding overall. We'll just kind of show you how we compare to other Iowa libraries.
I think that'd be great.
I'd be
Yeah, if
happy
you
to
could
share
share
that.
that with the board, that'd be fantastic.
Absolutely. One of the things I would like to point out in that is that our library was, for Marion County Libraries, was the top, and this is all based on stats from the 21-22 report. That's what was listed on the most recent year at the state library site. So we had the most percentage of programming for our class, and then as compared to other libraries in Marion County. So let me just read it. And that would be maybe more understandable. Okay, so we had 114 programs in that year with 2,100 attendees, which put us between the 50th and 75th percentile for size C libraries. That's the best percentage rating, taking into account each library in their class. The following year, we increased the number of programs to 152 with 3,295 attendees. So an increase of 33% and 43% respectively. So we continue to improve our numbers and programming, both in the amount of programs we offer and the attendees that are there. The point with this is we don't have as good a circulation percentage-wise as some of the bigger libraries, but our programming is really high. I think that goes to show that small towns don't have a lot of other options for programming, for education, for community type based events. And they'd really look to our library in Pleasantville for a place to come for that kind of thing. The bigger libraries have a lot of, or towns have a lot of different places that offer programming and that kind of thing. So that's one of our really valuable assets for Pleasantville. There's not a good way to represent that in a funding formula. So right now, the funding formula is a $4,000 base plus the percent of circulation for rural population for that library. That's not a very good, that doesn't work well for the smaller libraries, in my opinion. Also, that $4,000 is kind of just a random number. I feel like that should probably be raised. I feel like that's been like that for quite some time. We are trying to work with some of the libraries. It's been slow going as we try to figure out what's going on, being newbies and communicating with people and not, just getting people on the same page.
So I want to make sure I understand this. So the $4,000 funding, are you talking about what the statutory levy rate is for libraries?
No,
Or are you
we're
talking
not.
about
I'm
something
talking
different in
about
addition
a
to that?
formula based
It's 5,000. I think you're talking about 5,000. The base is 5.
Oh, then that's
That's what I
raised
thought.
from what the information I got from the state librarian.
Yeah.
So,
Yeah. Okay. No,
Okay.
thank you very much.
yeah, thank you.
Appreciate it very much. And board, if there are no additional questions, this will be a topic during our budget discussions to review the recommendations and take action accordingly. As you can see up on the board there, we've got the, I think the budgeted shared, Jake, that is
This was current year.
current year. Okay. And remember that the statutory levy rate is just about 7 cents, so it's
Renee goes back to screen.
0.0675 is the statutory levy rate. All right. There you go, right there. It's on the screen for everybody to see. So Marion County has exceeded that minimum by about $33,000. So something for us to talk about when we get to this section of our budget discussion. Yes.
Previous years, we've looked at all 99 counties and funding. And if you're okay, I know I have a printed version of all the 99 counties and what the library funding is for Marion County, which averages to $8.17 per capita.
Okay.
Um,
Yeah, you want to share that with us? Yeah, thank you. Perfect. Perfect. Thank you very much.
Thank you.
Thank you. All right. Well, very good. Ladies, thank you.
We
for
got our
break-
books to read.
I was going to say, homework, homework. Thank you for braving the weather, coming in
Thank you.
and talking. We sure appreciate it. This will be a topic during our budget discussions. Is there a motion to close discussion?
Make motion to close discussion.
Second.
Ramey,
Aye.
Johnner,
Aye.
McCombs.
Aye.
All right. Thank you. Ladies, thank you again. Appreciate it. Thank you online.
Thank you.
All right, we have resolution 2024-18. I think Michaela's up probably for the next two. Three. All right. Michaela.
Yeah, so these are kind of the annual housekeeping duties that I bring to you guys. Really, this should be our easiest meeting all week. The first one is to cancel the outstanding auditor's warrants. All three of these are required by code. I like to have them done by the time our independent auditors come in February. So the outstanding auditor's warrants are the expense warrants that go through Jake's office. These are anything that is outstanding as of June 30th of 2022. As you can see, it's only $104.90 this year. I think in particular, having mobile deposit really helps us be able to get a lot of those smaller checks that we used to have to write off. I think people are a little better about getting those in their accounts now. Gave you a breakdown of how much of that will go back to each fund. General fund gets $94.90 credited back to it once we cancel these checks. Fund 20 gets $10 back. So
Okay. Very good. Is there a motion?
Yeah, make motion. Make motion to approve resolution 2024-18.
Second.
Johnner,
Aye.
McCombs,
Aye.
Ramey.
Aye. Michaela, 2024-19.
So basically, same concept. This is on the treasurer's side, though. So this is the checking account that we administer and monitor in the treasurer's office. A lot of things like motor vehicle refunds come out of this. Our tax sale redemptions, payouts, that sort of thing. So again, very, very nominal amount this year, which makes me very pleased. I like to see that. Total of $70.15. And most of those are just motor vehicle refund checks that
Okay.
never got cashed.
Board discussion? All right, is there a motion?
Make motion to approve resolution 2024-19.
Second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
All right. Treasurer semi-annual report.
Yeah, so this is a fun report that I bring to the board twice a year. Obviously, this is mid-year, July 1st, 2023 through the end of December 2023. Gives a great snapshot of where we are as of that date. Again, as I say every year, Jake and I work very hard to make sure that everything we do on the daily feeds into this report. You guys see that monthly when Jake sends out all the month-end status reports. And this is just kind of a culmination of all of that data.
I think from an audit standpoint, Jake, this checks all the boxes.
Yeah, she's doing it by officially filing this. It's kind of it's in the code that she has to do this, but I don't understand it because it's just a snapshot in time.
Yeah.
Of that we send out all the time.
Yep.
So.
Yep.
Michaela's
Any-
checking the box for the auditors. They'll be here next week.
Absolutely. Any questions, board?
Nope. Motion-
All right, is there a motion?
Motion to file and receive the Marion County Treasurer's semi-annual report.
Second.
Ramey,
Aye.
Johnner,
Aye.
McCombs.
Aye.
Thank you, Michaela.
Thanks, Michaela. Next, resolution 2024-20. Tyler.
Yeah, so before you have an agreement for engineering services for 168th Place Bridge south of Vermont Drive. This is preliminary engineering, fairly complicated project on a low volume road, but it has a significant detour, serves a large agricultural area. It is low volume, but it does meet the 25, it is above the 25 vehicle per day limit to be eligible for federal funding. So it will be a federally funded bridge project once we're completed with the T-15 Flagler Bridge. And the reason we're getting on this now, so we can better budget this time next year, or have a better understanding of what we need to budget in our 5-year program for federal funding and locally, because this is on a local road, we have to cash flow this and get reimbursed. So we wanted to get a better scope. It's a complicated project because most of the road is within the floodplain and the channel alignment on Cedar Creek is absolutely horrible near this bridge. And the bridge is undersized. So we know it's going to be a quite a bit larger bridge. There's going to be quite a bit of channel realignment. And with that, there's new channel mitigation, wetland mitigation, potential other impacts that will all have to be permitted and evaluated. So this project is currently slated for FY26 bid letting, but we will be placing that in our 5-year program this time next year and want to have those accurate numbers, again, for our local budget to cash flow, but then also for to get that federal dollar amount in our 5-year program accurately. This engineering, preliminary engineering, and ultimately the final design and everything will be paid out of our local secondary road budget as well. Typically, we use farm to market, but this is a local road and not a farm to market road. But it is a federal aid eligible bridge.
Okay, very good. Board questions for Tyler?
I don't.
Nope.
Steve? All right. None for me. Is there a motion on this resolution?
Make a motion, we approve resolution 2024-20.
Second.
Jake?
Johnner,
Aye.
McCombs,
Aye.
Ramey.
Aye. Very good. We have a road department Weiler reclaimer. That's an interesting word. Purchase and joint ownership. Tyler?
So this is a little sooner than I anticipated having this before you. So a little backstory, we've debated on purchasing one of these for a while. We did our first major gravel road stabilization project last year, and we rented a piece of equipment. We actually rented the exact piece of equipment that I'm discussing today from a different county. And the reason I'm bringing this up is because that county has decided to sell that piece of equipment. And we've had some preliminary, the joint ownership part is we've had some preliminary discussions with Jasper County. Their county engineer is doing a lot of the gravel road stabilization as well for the past couple of years. He is interested. I reached out to him and didn't get an update. He's probably had a week like mine last week. And because he was going to take it to a work session last week with his board and discuss, but I have not received an update. But I'll give you a little bit of information. So this is really a preliminary discussion on whether to gauge your interest in pursuing purchase, how we make that purchase, and potential joint ownership with Jasper County. So let's the joint ownership thing. We have had that here in Marion County before. We have joint ownership on some traffic signals with Mahaska County. We have via a 2080 equipment sharing agreement. We have another emergency response equipment sharing agreement. Some of our neighbors just recently entered into a 2080 agreement. I think 4 or 5 of them went in and bought a Weiler shoulder machine together. So I think I attached some of those example agreements in your agenda packet. So it is doable to have a joint purchase. As far as equipment sharing, we already had preliminary discussions on when and how we would coordinate that work throughout the summer period. This would be, late spring to early fall is when this machine would be utilized. And both counties are doing 4 to 5 miles a year right now, which is about 4 to 5 weeks worth of work. Maximum, we hope to do it in 2 to 3, but if something was to slow us up a little bit, so 10 weeks throughout the entire summer, this machine would be utilized amongst the 2 counties, doing 4 to 5 miles each. So the machine is on auction. That does create some problems, some challenges, and not anything we can't overcome. It's online auction. Counties, we spoke with the auction company, counties in Iowa have purchased from the auction site before, and they have means for us to do that. Basically circumventing some of their requirements for making payment, as soon as within so many hours after the auction closes and that sort of thing. So there are provisions for that. I don't have all the details on that. I didn't get them from Mike because he was out this morning. So the benefits of this machine, the benefits would be, currently we're spending about $10,000 per, well, let me rephrase that. It's about $9,000 to do 2 miles. So it's about $4,500 a mile to rent just that machine. Then we have operator, transportation, and whatnot to get that machine here and for someone else to run it. That was renting it from Clark County. If we were to rent this machine from a rental company, there aren't any available that we could find. So we'd be going to the next size, bigger reclaimer, which is significantly more expensive. We're looking at a minimum of $15,000 to rent a machine to do a 2-mile segment of road, or $30,000 for a month, because a month is their minimum rental period.
Is the minimum?
Yeah.
Is the minimum, so you have to rent it
can't
from.
rent these big of machines by the week. So the benefits. So what we've been doing is what was called a base 1 gravel road stabilization. And we started doing this after a number of other counties. We had visited a number of other counties that have done significant numbers of miles, so 20, 25 miles plus, and seen the benefits in wet years and dry years. And, I've been to multiple presentations on this, and we had done a couple test sections as well. Last year we did our first one. So our actual cost to incorporate, now this includes all labor, materials, the chemical stabilization product itself, the rental of these machines, was $75,000 a mile. So to do base stabilization in Marion County, it was $75,000 a mile. And that is a 5-inch stabilization on our highest volume roads. So I looked at the cost of, that's a pretty big outlay for initial cost on a gravel road. So I looked at, on those high volume roads, what's our payback period and how much is it costing us? Or, when would we get paid back and what would be the savings over a 10-year period? Because, the manufacturer of the product states, 10-year minimum life, if not more. There's areas in Minnesota that have had base 1 stabilization roads for 15 plus years. None in Iowa over 10 years yet, getting close. So, assuming 3% inflation over 10 years, it would say every mile we did stabilization on would be a $53,000 per year savings, or a 5.8 year payoff. So after we outlay that $75,000, it'd take us 5.5 years to pay that off. And that comes out to, costing savings of $5,300 per year per mile. But the fact is that our 8-year average inflation on labor, equipment, and materials is not 3%. It's closer to 7.5%.
Yeah.
So I used 7.45, which is what I calculated out of my actual budget numbers that we saw for rock inflation and that sort of thing over the past 8 years. So using 7.4%, it was close to a $90,000 10-year savings on the gravel road stabilization, which is a 4.5-year payoff on these high volume roads and $9,900 per year per mile. So, if we were looking at a $300,000 purchase of this machine, splitting that with Jasper County, $150,000, make easy numbers. And we're saving $9,900 per year per mile, doing 4 to 5 miles a year. That would be about 3 years to pay for the machine. And there are other benefits to that machine as well that we could use for stabilization prior to seal coating in our subdivisions. We could do full depth reclamation in a few areas that we've considered it. Kind of been cost prohibitive to pay a contractor to do in small quantity. So there are other benefits that I wasn't including in here. But this is really just to open the discussion. I don't have the money to pay for this in my budget. So that's really why I'm here. I think there are benefits, and I can definitely get you more numbers or more details on any of these numbers. But there is a payoff period. It does take some to outlay for the initial cost of the labor, the materials, and the proprietary product that we've been using. But there are benefits there, and the savings that I'm calculating include the reduced maintenance. So there's less maintenance, less blading on those gravel roads, and that savings also includes not the cost to haul the rock there over the next 10 years, and then the cost of the rock itself.
Okay, Tyler, I appreciate all that analysis. I struggle with payback concepts for things like this because they're just expenses to me. When we're looking at the nominal savings between doing what we do now versus what you're proposing, what's the savings per mile?
Per year?
Per year, per mile, however you want to do it. What we do right now, the practice we have right now, and what you're proposing, factoring in a much higher inflation rate, because that's where we are and probably where we're going to stay for a while, what's the savings?
Well, $9,900 per year.
Okay.
On the roads that you would do this
On the
on.
road, the type
Right,
of road. Yeah,
that's-
this is not an every road thing. This is
No, I
just
understand.
putting high volume gravel.
I understand that.
That's
So
where-
so that's why the rental makes sense, because we're not going to utilize it. So then you got utilization as well. We'll share with Mahaska on the utilization piece. But
Jasper, yeah.
yeah,
Yeah.
or Jasper, whoever we're doing this with. So 9,900 per mile a year. Okay. Very good. Thank you.
And there's
And
other,
that's with the assumption of a 10-year life based off. Yeah, it very well it will be longer than that.
Is that kind of the average lifespan
Yeah,
of
that's
these
the average. Like I
pieces of
said,
equipment?
Iowa, a lot of counties in Iowa are getting close to that, but Minnesota, a lot of them have been in since like 2008 and 9. Some of the
Okay.
first gravel road stabilizations they did. Still
Okay.
seeing benefits.
Okay.
and I think one thing that I think it helps us to be able to, when visualizing this, also, when you talk about the wear and tear on the maintainers, when in a road stabilization during like summer months, you're not having to do this every 2 weeks, right? You're looking at maybe, how often are you having to grade a road? Meaning once you got the road stabilization.
Roads of this volume, we're typically blading once a week. Twice a week.
But when you have the road
Oh,
stabilization
once
done,
it's stabilized?
Yes.
2 to 3 times.
so
We
so
go
there's
from
some
blading-
cost
So
savings.
there are attendant cost savings for other types of services by
Yeah.
doing this.
Yeah, and then that time can be spent on other roads as well as future budgets. as
So-
rock and
So
fork.
the whole plan is really, we're going to save money by renting on a nominal basis. The payback really is we save money because we don't have to maintain the road as much. That's where we save the money.
Rock and- Yes.
Okay, that's what I wanted to make sure.
But yeah,
Because there is no, in my mind, Tyler, there's just no payback.
No,
To
no,
this.
no. I mean, like a lot of what we do, we've had these
Yeah,
discussions
yeah, yeah.
before. It's not savings to the taxpayer.
No,
Other
no.
than in the level of service and our services being reallocated to better,
Exactly.
for better upkeep on another road over here, while this one's already got great.
Yes, yeah.
level of service.
All right, I get it. Thank you.
So this piece of equipment is on auction currently, correct? And it's going to end
Yeah.
in the first part of
Yeah.
February, I believe.
Yeah, that's kind of the challenge here, and I totally understand when I come to you and say, I don't have the money to pay for this, but I see the benefits and it's on auction and we have a short time frame.
150,000 you need?
No, it's,
So,
the
yeah, so
price is,
Weiler has a used machine similar to this with a few less features currently for sale for $295,000.
Okay.
Clark County bought it 2020, I think, or 19 or 20 for 360,000.
Okay.
It's on auction. I imagine it'll go for 250 to 300,000.
Okay. So,
So if we were to split that equally with Jasper County, we would be looking at.
We don't know if Jasper
125 to
County's on board yet though, right?
We do not. I have no, other than their engineer is interested in it and
I did speak with Doug Couples, yesterday. I sent
Okay.
him this information. Their engineer had spoke to them about it. And they hadn't finished up, speaking, doing all their budget stuff. So he was gonna further look at it. I said, okay. He seemed interested, but he is one person on that board, obviously.
well, for $150,000 outlay, if you're saying that this will reduce the need for maintenance on the roads that this is utilized on, what's the estimated savings? So if we're not going to have to gravel grade as much, so that's where your payback is, right? Your payback is you invest 150,000, you partner with the county, you share the machine. This takes our crews, our graders, our rock and everything, and we can do something different with them. Do we have an idea, or are we just kind of, and it's okay, Tyler, to say, look, we're just kind of guessing based on what Minnesota has done or what a few places in Iowa have done.
you're talking about in dollars. I mean, I can tell you in true dollars what the savings would be with inflation of rock. Like,
Yeah,
we
yeah.
don't have to rock these roads for 10 years after doing it.
Yeah, that's what I'm saying. If you're saying if we don't have
Yeah.
to do that for 10 years, what's that cost savings?
Tell you. I had to have Tammy text it to me. I left it off.
The materials, labor,
Yep.
maintenance, machine maintenance.
So on a road like
That's
this,
your
the-
payback.
the material savings over 10 years would be $118,000 per mile over a 10-year period. So the materials alone.
What do you think, Steve? That's easy, isn't it?
Well, yeah, it's easy if Jasper County wants to go along with it.
Right.
With inflation, that
Now, I'm assuming that in the 2080 agreement, Tyler, there'll be some kind of a prorated maintenance deal
Yeah.
that
typically there's,
based on the hours of use from either county.
yeah,
on-
typically there's maintenance and insurance laid out in the agreement. I think one of the examples I sent you, it even had kind of a scheduled rotation for the 5 counties on when and how.
On what
who would
month it
do
got
what.
used.
Yeah, and
Yeah.
it was laid out over like a 10-year period or
Yeah.
something like that. I think
We'd have to
the
do
one,
something
the
soon.
2080 we have with Mahaska County was slightly different because they were receiving the grant and owning it, and they maintained the insurance and whatnot. And it was a requirement of the grant that they have a partner in that, partner in county in ownership. So that one was a little bit different. This would be a little more in equal shares, I would, if we drafted a 20.
The road that we have stabilized, how's that holding up?
Fantastic.
Okay. I
Probably.
mean, that's a good example of what,
It was dry.
right.
Once you stabilize these, it takes a lot of moisture to do a good blade, do some good while blading it, and we just didn't get that this fall. But no, they're great. We've done two road segments, so we did about 4 miles last year.
I don't have a problem with this as long as we can get Jasper County to.
Well, I guess I would say it this way, Tyler. I'm okay with you having conversations with Jasper County to see if they are open to this idea. Have you had those? Are they,
Yeah, just with the engineer who was going into that work session, and I haven't heard anything since
Okay.
then from him and his board. So yeah, and that's what this discussion was about, just to kind of lay it out there. Yeah, I didn't get quite the number presentation I wanted.
No, that's okay.
Last week for you. But yeah, if you are interested, I can move this conversation forward and on a fairly quick basis here
If
over the next week.
if those numbers are even close, I'm interested in terms of the savings. Because that's huge. That's a huge savings to the maintenance
Yeah.
side of our rural roads.
I
So
like the
yeah,
idea of saving that, I like the idea of saving those costs, but also redeploying services
Yep.
to a different location.
Yep, absolutely.
In the long
So
term.
I can tell you, Mark, that the roads that we did last summer, I took that tonnage and I reduced our rock budget by that tonnage. So we're still maintaining all our other roads the same. I did that because of the 11.5% inflation in
Yeah.
rock. I needed to make the budget numbers work. In the future, if we're a little more balanced in our rock budget, that tonnage might be reallocated somewhere else.
Yeah.
Versus just reducing the budget. But I can tell you, immediately we are reducing our budget in our rock tonnage because of what we did.
That's excellent. I would say definitely go forward. I don't, there any,
No,
have
I
the
appreciate the-
discussions and see what you can bring back to the board for some type of approval from an agreement standpoint. Maybe, and make sure to loop Jared in and,
Yes, yeah, I think I mentioned that. We would have to make sure, have them review in the 2080 year.
do you need a motion for you to move forward? Jake, do we need anything?
Probably be good for
Yeah.
Tyler, just so you.
So board, I would entertain a motion to allow Tyler to continue these discussions with Jasper County on a partnering in the purchase of a reclaimer.
So moved.
I'll second.
Sorry, that one's a little different than approve. All right, McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
All right, very good. Tyler, thank you.
Yeah, thank you. I will continue those discussions.
Absolutely. Now we have a road department update.
Yeah, like a lot of things, I'm kind of all over the place here, so this week, so.
That's all right.
I wanted to touch base on a few things, not budget related. I'll talk briefly on my budget this afternoon. So snow removal, you all received, the letter press release that I wrote last year, and I just want to reiterate my gratitude and thanks to our employees. And this is not about me at all. This is all about those guys that were out there grinding day in and day out. And I appreciate everything they do, as I do know the citizens appreciate it as well. I think they did a fantastic job. Mike and I discussed a plan. We stuck to the plan. It was a little different than our normal operations, but the guys took it and ran with it, and they executed that plan and met our goals. And could we do it faster next time? Maybe. We learned a lot. I've been here 10 years, haven't seen a storm like that, and neither have the majority of those operators that we have. So a lot of new guys. We have guys that have only been here a couple of months, and they really stepped up to the plate. And the elder employees, they were out there teaching these guys, and it was fantastic to, I mean, with the struggles we had with it, it was a great learning experience for our department, and it was good, staring down the retirements that we have in the next 4 to 5 years, to be able to pass some of that knowledge on with real world experience. So all in all, I'm happy with the way it went. We will debrief when things settle down, maybe this week, and come up with a plan to be better next time.
Mhm.
So
Yeah.
Excellent.
I just thank all the employees for what they did.
Absolutely.
There's lots of sacrifice and struggles, and it's stressful emotionally and physically and all of that, but they endured it and persevered. So I thank them all. Recently, we've had some public interactions. I presented at the Farm Bureau of Marion County Board meeting, discussed our, what we do, what we're about, some of the struggles that we have, some legislative issues. And Scott, our engineering technician, he did another presentation and demonstration at North Star Elementary with the tag group there. And that's becoming a reoccurring thing. I think they liked what he did with them last year, so they've invited him back again. And we like to do those little outreach things with the schools whenever we can. Kelly has been emailing me on some legislative issues that have come up recently. One just last night or this morning regarding motor grader training. Why at the legislative level, we have to mandate what counties do for motor grader training. We are doing it. You know, we train our staff on site. And when the next opportunity presents itself for that operator to go to the formal motor grader training that Iowa LTAP puts on, we send them. This would just say they can't operate on a county road until they've had the training that's offered once a year.
Do we know who is pushing that insanity?
I don't know. She emailed me while we were sitting here, but I didn't. It was right before I.
So let's
sat
get a
down, so.
name attached with that and see if we can have a discussion. I mean, they're sticking their nose in everything
Yeah,
that we
I
do,
just got that. I'll forward it to you all. From
and they're
Kelly
not making
yesterday.
things better.
I mean, then there's the bill for the mine related activities and the mine subsidence of interest to us. I haven't got a legislative update from the County Engineers Association recently, but at our last executive board meeting, they did discuss a couple of issues that have come about because of House File 718, which I believe Jake will talk about later, which is related to the
Property tax reform.
yeah. And how that relates to secondary roads is some counties, because of their reductions that in their levy rate due to House File 718, they're unable to meet the statutory minimums for the road department because that's based off your total valuation and not the levy rates. And
Yep.
We are not in that boat, but it sounds like there are a couple counties that are. So it's
Mhm.
just something that our association will be keeping our eye on. Junction 92, last week, we held our pre-construction meeting for Junction 92 for the main shop building. And tentatively, the start date is March, early March. That'll be weather dependent. We met with Mid-American out there yesterday to do temporary relocation and get temporary service out there for construction. We met with the contractor, Mid-American. The discouraging thing that we learned at the pre-construction meeting was about, they call it electrical gear or electrical equipment for the building. Apparently has some 55 to 60-month lead time or week lead time, which puts us beyond our substantial completion date. So hopefully more will be known about that. Apparently that's all that's been increasing, but there were some things that the electrical contractor said that could possibly have them catch up on that equipment. So that's just something else that we'll be watching and could impact our construction schedule. You know, we've already told the general contractor, you know, if the building, everything in the building is done, but we can't power it, you know, the completion date's December 31st. How do we manage that through a winter if we can't power it till March? So they're thinking about that, but, and we'll stay on top of that as we go. And then my last thing is just project coordination. Flagler Bridge was delayed that last week. They're going to get going again here pretty quick. There's been demolition's gone well. The bulk of the bridge deck over the railroad itself, which is a very time-consuming part of the demolition, having to protect the track and remove it every time a train comes by and then put protection back, that sort of thing. The bulk of that is done, so that's good. But demolition will still be ongoing through the end of January and then start on the substructure work for the new bridge. We've had a couple meetings with the Iowa DOT about project coordination and not so much in this upcoming year, but in one of their bridges got delayed. So they were gonna have a bridge that was detouring traffic onto T-17, which is going to be a detour for a couple of other projects, one of ours and one of theirs. We're gonna put a lot of detour traffic on T-17. It sounds like that will now be constructed in 2025, so we'll avoid those conflicting detours or having multiple detours on the same route. But there will be more to come on that, because that's gonna create some challenges for secondary road users of Marion County along the Highway 14 corridor. I don't have the final details on what their plans are and how the DOT plans to manage that. It sounds like there could possibly be some public forums to gain feedback on that. But really, they'll shut down Highway 14. It's how do they manage the traffic coming and going off of our secondary roads? So more to come on that, but I'll continue to keep up with the DOT if they don't communicate with me. But we had a conference call last week, and everybody was kind of in snow mode, including the DOT. So more to come on that.
Very
That's all
good.
I have.
Tyler, thank you, and thank you to your team for all their work. I speak for myself. I just appreciate everything you guys did. And when you say that, first snow that many of them have seen, a plan lasts as, the old military adage, as long as you meet the enemy, right? And you learn and you adjust, and you guys are doing that. I think that's great. So thank you for your leadership.
Thank you.
Thank you. Make motion to close the discussion.
Yes, thank you. Is there a second?
Second.
Ramey,
Aye.
Johnner,
Aye.
McCombs.
Aye.
Very good. We have compensation board,
Yep.
Jake.
Yep, so, Bill Shepherd dropped off, he chaired the compensation board. You guys received minutes yesterday. General practice for you guys is to receive and file, to acknowledge that and, their work. And then you guys can decide when you want to deal with it.
Absolutely. So you have the minutes in your packet along with the breakdown. And again, this is a topic during our budget discussions. So is there a motion to receive and file?
So moved.
Second.
Johnner,
Aye.
McCombs,
Aye.
Ramey.
Aye. Very good. Thank you. Updates. Mr. McCombs.
Oh, other than I've had to cancel some meetings to make our budget meetings.
Mrs. Johnner.
That's me too.
All right. Same here. Consistent update. All right. Is there a motion to adjourn? Jake, do we want to adjourn or do we want to break and then
I
reconvene at
believe we
one?
have a second meeting posted, so I would adjourn this regular
Very
session.
good.
and then-
I'm sorry.
I believe you were going to make an announcement regarding the assessor.
I was. Lisa, why don't you come up and make that announcement? Since you did all the work.
I expected you to make but anyway, I forgot to give you my sticky note,
That's
but
all right.
just a heads up, the conference board did hire an assessor, Andrew Jenkel.
Gentle.
Gential, thank you. And speaking with him, he is going to start on Monday, February 27th. Little later in February than we kind of had hoped, but with schedules and start dates and such. So he will be arriving on February 27th
Very good. Lisa, thank you.
or 26th. I said 27th.
26.
26th is a Monday.
All right.
Yes.
Very good. Lisa.
Thank you.
Thank you. Thank you very much. All right. Anything else for the good of the order? We'll see everybody back here at 1. Is there a motion to adjourn?
Motion we adjourn.
Second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Very good. Thank you.